Hi, I'm Dr. Winnie King with a really interesting video today. This is on bioenergetics, and this is a field of medicine, it's integrative medicine that you may or may not have heard of before, but it's extremely effective. And I want to introduce you to a very good friend of mine, Jaime Doise.
Yes.
She is a bioenergetics practitioner, and she and I met several years ago. She introduced me to this exciting field of integrative medicine, and I want to share it with you. She and I have partnered to provide this service to you because it's just so important and it can really be life-changing. You know, here's the deal. The human body is an amazing organism, as you know, and doctors, they use various conventional ways to try to diagnose and treat problems. And the way in which they come to their diagnosis is with, of course, a physical examination and a history, but also with lab testing, meaning blood work and maybe CT scans, x-rays, MRIs, to try to figure out what's going on. But there's another level that is not really embraced by conventional medicine, and that's on the energy level. You know, the human body has energy, and all throughout our body we have energy fields. You have an energy field around your eye, around your head, your brain, your lungs, your heart, your pelvic organs. All of these parts of your body operate on energy. Now, we don't in conventional medicine really tap into that, but it can be tapped into, and when identified, it can be used to correct problems. Because when you have something that's gone on in your life, whether you were a child and you had a traumatic event, a physical event, a car accident, some type of injury, it can cause a distortion in your energy in certain parts of your body. And that will manifest clinically, whether it's depression, anxiety, something will happen that conventional medicine doesn't really have a way to identify. And that's where energetic medicine comes to pass. How did you get started in this type of technology?
So my own health journey brought me here 9 years ago. I've been in the medical industry for about 25. I always had an interest and passion in helping people, but my own health journey brought me here. I had some mysterious health issues that they just couldn't figure out. It was idiopathic. I had kidney problems, and one thing led to another, and I just knew that there was something else to be done. And when this crossed my path 9 years ago, I was like, this is it. This is the missing piece in healthcare.
Yeah.
And so a lot of doctors just aren't trained or geared to do this type of stuff, because you're right, they're geared to do
The lab
traditional
testing and all those
Western
things,
medicine.
right?
This just basically bridges the gap between that Western medicine and Eastern medicine, and we're not here to take away business from them. We're here to work together, just like you and I are partnering together, because at the end of the day, it's the patient that matters.
Absolutely.
And so we're peeling layers back, basically taking your body like an onion and peeling the layers back to identify not only the energy distortions and the organs shock and trauma, but we're also looking at the emotional component, which plays a big factor in our health.
Yes.
And so it's a beautiful marriage between the two together.
And the nice thing is that it doesn't hurt. You know, it doesn't involve any needles. This is just simply measuring energy pathways throughout your body and then finding where there's something wrong, where it doesn't line up the way it's supposed to, because all of the energy fields have already been mapped out by the organization that you're a part of, so they know what's normal, what's to be expected. And so by scanning you, they can find out where you're a little off here, a little off there, and that's where the magic begins, because once we know where you're off, now we know how we can fix you and get you back in alignment energetically the way you're supposed to be. So, okay, a new patient comes to you. Of course, there's a consultation, talk about the history. Just in conventional medicine, we need to do a history, but then what do you do?
So basically the way I get patients to understand how this works is everyone knows what an EKG does or how it works. Basically, we're doing the same thing. Every organ functions on a specific frequency. So when we can actually measure where your body and organ is functioning on that frequency, your body is giving us information. And so we're able to look at the missing information in the body field in the form of frequency, the form of vibration. And when we can identify that and put the correct frequency in, the body has an innate ability to correct itself.
Yes.
And so typically a patient will come in, they'll be in a very relaxed environment. They'll place their hand on this scanner. It's non-invasive. The scan literally takes 15 seconds.
Yeah.
The consultation, however, will take a little bit longer, 45 minutes to an hour and a half, only because we're peeling layer after layer after layer back. And we're getting to the root cause of why they have certain things. Why did they get this specific diagnoses? And so it takes the anxiety off. of them. So we go through that. It's very relaxed. Usually I'll have some responses within the first session. Sometimes it may be a little bit longer. It just depends on the complexity of that condition. But typically it's very relaxed and takes little time.
Yes. You know, I have performed this on patients, and it's amazing the information that the scan alone will tell you about a person. I scanned one young man who I really just wanted to get a sense of what was going on with him, and we discovered that there was an energy distortion in his right eye. And so I asked him about his eye, you know, do you have any problems? And he looked at me and all the color drained from his face, and he said, I'm blind in my right eye.
Right, I
you know,
that.
You remember that
Yes,
guy? And so this scanning technique really picks up on what's going on with you, whether it was an anger issue that you had with someone in the past that's caused a distortion in energy. This is so accurate until often people cry during this event because their lives are sort of being revealed,
right.
You know, and some things that they may not have even realized were there are brought back up to the surface. So now once we scan them, we know where the distortions are. What's the next step?
So we actually can do a voice analysis as well that measures the vocal cords.
Yes.
It's very unique how all of this kind of just ties in together. We're looking at not only the voice itself, but it's looking at the organs in more detail. So we can actually look at, you know, is that organ actually having inflammation response, or is it being sluggish just by your voice?
That's amazing. I mean, literally you talk and this device measures your voice and then gives feedback about what's going on in your body. Your voice literally is a reflection of what's going on internally.
Right, and not only that, it actually emails the patient or the client an MP3 downloadable version of a tuned vibration. So we use the solfeggio scale. So if you can continue to put the correct frequency in the body does have an innate ability to correct itself, and that's what our main focus is putting the correct frequency and the information to correct the body field.
Yes, well, and that's the premise of all of this, and that's one of the things that I embrace as an integrative physician, that the basic fundamental belief is that when the body goes awry, it has an innate ability to right its path and correct itself, and all it needs are the right tools, the right information, and it will kind of guide itself back to where it needs to be, and in so doing there's no side effects. You don't have to worry about other bad things happening in the process, and that's the beauty of integrative medicine, and in particular energetic scanning. So now once we've done the scan, we know where the distortions are, then the next thing is going to be actually trying to do something about those distortions.
Right. So there's many different things we do. First, we unblock the energy distortion using the PEMF, which is a pulsated electromagnetic frequency. This unblocks, so basically your body is functioning like a faucet. When we go through a faucet and it's clogged, what happens? The water doesn't come out. This device here actually unblocks the energy in the body field so your body can work like it should. Then we do what we call infoceuticals. This is frequency that has been into structured water, so it's again all the organs work on a specific frequency. This is giving us a map of what the body's wanting to correct. And so the client or patient will take this every day for a minimum or maximum 21 to 28 days depending on the complexity, and then we'll rescan them in about a month's time and kind of track their progress.
And these are drops, folks. I mean, these drops, you know, this is based upon a Nobel Prize winning physician who was able to discover that information can be put in water, and so this water has been imprinted with frequency information that when you put it in your body, it goes to those areas that need to be fixed, unclogged, corrected energetically, and it helps to do that. This, you happen to have brought this one. This is one of my favorite ones.
This is the universal one.
Yes, everybody loves it. It's called Chill. And when I'm stressed out, or I've got a lot going on, and I feel myself getting tense, I'll put a few drops of this on my tongue, and it is unbelievable how I'll feel so relaxed. I'll feel so calm, because what it's doing is it's going and it's unblocking those areas that have become blocked because of the stress. There's, so many of these infoceuticals, and when you have the scanning done, a customized approach is put together for just you based upon your specific blockages. The treatment is customized to you, and then the infoceuticals prescribed are also customized to you. And what we know is that this works because when we do come back a month or so later and rescan you, those blocks that we saw before, they tend to go away. They get better and better and better. So we can clinically prove that this is helping you. And more than that, you feel better. I mean, my patients are just shocked at how much calmer they feel. Whatever troubles they were having get so much better. This is an exciting technology, and as you said, Jamie, you know, this is not taking away from conventional medicine.
That is
this is just simply integrating into it. And if we can help make you better without invasive side effect associated medications, why not take advantage of it? It's very affordable, highly effective, and something that just about everybody can benefit from.
Right,
you know?
and there's no contraindications, which
That's
you know,
right.
a patient can continue to take their current remedies of medications or
Sure.
supplements. This will not contraindicate any of those things.
That's right.
Not to mention it has zero taste.
That's right, and it's really, really effective, especially the chill. Love the chill. If you'd like more information about this exciting program, just call our office and ask about bioenergetics. We'd be happy to talk with you about it.